we ended last time and we were talking about before we had already ended and stopped. We had already ended the podcast. We talked a lot about teens. We talked some about the vaping with teens, and especially with COVID and the pandemic, if it ever is over. What are your thoughts, and how big of an issue is this in Europe right now with the teens? I mean, I see it all the time, even our young adults.
Yeah. I mean, I'm not a pediatrician, and I don't see kids as many. I mean, our clinic, we do see some kids, but I don't see them. But
I mean, we have 5 adult kids, like young adult kids on our own. And I would say 2 out of the 5 have a vape all the time. And they're at that age where you can't really say anything or pick them up, put them in, in their room and say you're grounded. So it's like,
yeah, I mean, I have 13 and 15-year-old and they see that I'm in this. I constantly, they've read parts of my book. They're in some. So, but I see that. I think it's a huge problem because they come and I ask them. I have some of their friends sometimes come and we have conversations, or their my friends would have kids who'd start using, or my kids' friends will start using, and their parents will come. And so and the problem is getting a lot worse. And the bigger component of that is the access, and access is getting easier. And especially since Delta 8 and 10 came out, that's just I had this very unpleasant few situations where good friends of ours were calling me and saying, look, they were in an illegal state. There was no medical or recreational, but the kids found a way to get things online, shipped to their house. And they were getting not just high, they were getting toxic.
Sure.
Because especially the Delta 8, we know that it's there is no clean Delta 8 as far as I'm concerned. Maybe there is, but if you since we can't even recommend particular brands.
Right.
And frankly, I feel strongly not to, because if I can have a controlled medical grade THC, it's definitely better. And until we have a clear evidence that quality is adequate for Delta 8, which, in an unregulated market, there's no way to do that. And so that's a problem. I personally have not seen deaths yet, but I've already heard of some. So I think, but I have seen at least one young adult who came with a severe toxicity that was Delta 8, and it was mercury and pesticides.
Wow.
And we had to show all the data to the parents and the patient and say, look, you got to stop this completely. This is going to kill you if you consume in this amount. And he came with a severe psychiatric breakdown.
Wow.
And it's a combination of probably just overuse of the psychotoxic substance.
Well, it's constantly in their mouth. It's like every couple seconds they're back at it again. Yeah. That's what I see.
Yeah, that's a massive overuse. I mean, that's when people probably consume hundreds of milligrams of THC equivalent a day.
Right.
There is very little benefit of that. In fact, the evidence of harm is so robust in this scenario that nobody should be doing this. And the question is, can you it always comes up in conversations, well, can you harm reduce this? Can you, I can't have him stop doing this. So can I at least, so you can say, okay, take some CBD, because we know CBD will positively balance this. But at the certain dose, I don't think it's even realistic, because the kids or young adults that I've seen and heard about, I mean, they were taking such a massive, I don't know if you can truly bypass toxicity from that.
Do you think, Dr. Kogan, do you think that it has become so much higher because the anxiety and the fears of of all of that they've been through have gotten so much worse?
I think so. I think it's an access. Access and cost are probably driving, because the cost is going down, improving. And people are people, right? I mean, there wouldn't be this, there would be alcohol, or there would be but it's because we're not addressing the underlying issues. Like, that common experiment, you put the rat in in a cage, give it cocaine, and it'll consume it until it dies.
Right.
Put the rat in a very beautiful social environment where they're happy and they get food, and you give cocaine and nobody's using that cocaine.
Right.
Happy. That's because look at our problems. I mean, we're not addressing our problems in an appropriate, holistic way. I mean, there's no effective mental health care in this country. I mean, sending patients to a psychiatrist and giving them antidepressant is not a mental health.
Oh yeah, absolutely.
Problem. It's just fixing the symptom.
Right.
So that's the same issue. So people begin to self-medicate with whatever, and until we have a structure in place that we can actually engage someone in an appropriate therapy and have them go through a process of learning why they have this drive, why, and each individual can think about your own tendencies. We all have some addiction tendencies. We all have some things that are leading to particular shifts in our health, right? So you could, if you're relatively healthy, but you know there are certain shifts, you can also simply start engaging in the processes of mindfulness and meditative practices where you will start learning yourself gradually better and better.
Absolutely.
That's another really important principle of integrative medicine, that when I get patients referred to us for issues of mental health, when it's pretty obvious that the patient is not ready to hear anything, that is a very common type of referral to our practice. Because instead of telling patients go see a shrink and it's all in your head, we will basically say it's not in your head. You're simply not able to get to the point of understanding where is that dysregulation. So let's spend time together and figure out, what do you need to get there? And is it a mindfulness, a mind block? Is it a heart block because there's an emotional trauma or something that has locked you in? Is it actually something biochemical, like a nutrient deficiency, hormonal toxin of some sort? And until you start looking at this that way and realizing that when you engage with the patient, you don't know on start what actually is happening. You have to really be comprehensive and detailed.
Yes.
Then things begin to unravel, and then you start realizing, oh, okay. I mean, you live in a molded house for past years. What do you expect? You can go see every shrink, but if the mold causing direct brain damage, shrink is not going to help you.
100%.
You see that a lot, by the way.
Yeah. Oh, I'm sure.
And unfortunately, also with an unregulated products that are also included, I have seen also patients smoke Delta-8 and then come back with not just toxins from metals, but also come with a horrible mold toxicity.
Yeeks. Yeah, I'm sure. That's terrifying. And I think with the young adults, that has been, I mean, not just because we have 5 young adults, together with my husband and myself, but, it's just terrifying when I see them, and it's like, it's always in their mouth. It's never not. It's like this nervous now, I hate to use the word addiction, but it really is. It's like, I'm so used to it.
But it's often to better position that, it's a self-medication.
Yeah. Oh, for sure. Absolutely.
Because it helps.
And it's inexpensive.
Yeah. It's available. It's inexpensive. It's easy to take. You feel better. You may get high, and you may like that high. So there are multiple components that support the continuous use. And, like the vets are also a very good example for PTSD. We know how effective that could be. And so, but then there's like, where do you stop? And also, if that's the only thing you're doing, you're never going to truly get better. So that's another, the big problem here. It's not that it's a bad symptom management. Okay, well, some of it could be toxic if you're getting it illegal. But outside of that, there's nothing wrong with the tool. But what's wrong is that the tool cannot get to the bottom.
So all you're doing is getting to the surface of it. And I would say, and you tell me if I'm wrong, doing that so often in the day, they're never getting sleep.
They never get quality sleep because, we do know that excess of THC is actually really bad for sleep. You may fall asleep, but the sleep is different. It's not a well-balanced sleep. Architecture of sleep is shifting. So, there's so many other problems, but also just the plain excess of THC. I mean, your brain changes negatively.
Oh, yeah.
Anatomy of the brain changes. I mean, you're harming yourself directly. The question is, where is that level? Like, people who use it a couple times a week just because they got home and they're stressed, I don't think there's going to be any harm in that.
Right.
I'm talking about massive doses on a regular basis because somebody is constantly anxious or they can't.
And I see much more of that than I do just with our young adults, and then topping it off with alcohol.
Right.
And then also they're on an anxiety medication. Right. And my mind is blown because I'm just like, what, how do we stop this?
And that, I agree with you. I think it is getting worse.
Yeah.
I think it's gotten worse because of COVID partially. I think it's gotten worse because of COVID, some of the pre-existing structures got disrupted. So now also, like, I don't want to say we're post-COVID because technically we're not yet, but like we established so many new things during the telemedicine and all this.
Right.
But we're still like in the first steps of getting to say, okay, now this is forever. We have to now solidify the structures and allow better access and keep improving them. There's still like all kinds of mess in there. Like, for example, think of it this way. We have all these states, and if I'm a physician and I need to see a patient for medical care from out state, the problem does not require me to see them face to face. Why on earth wouldn't we simply say, let's figure out a structure where I don't need to go get a license in every state? Because I would have to pay $500-$600 to each state every time for every year. For like, can't we come up with? I mean, so we will. I have no doubt that eventually something will occur. But it's just we're in such a rapid shifts of practice, not just what we practice. And so I think that unfortunately, a lot of the times patients become kind of get stuck in situations where the access becomes an issue because the infrastructure is not there.
Oh, absolutely. And honestly, what I hear most of the time is it's just less expensive for me just to get medication. And it is. And I understand when they are struggling financially, it is much easier just to get the medication.
So that often is the only thing that's covered.
Right.
Not just
100%.
The actual out-of-pocket cost of a drug, which many are cheap, but many are expensive. It's also the insurance coverage.
Exactly. So I want to move on now. Any progress you see federally?
Yeah, I think I'm very optimistic. I mean, I personally feel that we're a few years away. I expect, unless something super bizarre happens with the next administration, I think it will be on the next administration's agenda. Okay. And I think the main reason is financial. Because after all, I am pretty sure that the federal government is looking at this and saying, look, wait a second, that's a massive money making. We have to figure something out. And there's also, I think there's enough political pressure at this point, because we know that something like over 60% of Americans heavily support the initiative of making medical cannabis universal, not state patch. That's another problem. Like, okay, you live in one state, but you have to travel for work. It's illegal to move it from the lines of states. That is insane. If I am if I'm a patient and I have to go to work and it's my drug, how can I not take it?
100%.
And yet the federal government says you can't.
Oh yeah, there's been times where I've had to fly somewhere and the state that I'm going I can't do it. So then I have to go to medication for the time that I'm there, or I would never sleep. Sleep is such an issue with me. So it's crazy that we have to do that. But yeah, to your point, that is my medication to sleep. And it's like, are you kidding? So I agree. I'd love to see that changed in the next couple of years.
Well, I mean, I don't know what the timing is, but I think we're not far away. We're definitely way closer than we were even a few years ago.
Yeah, no, I believe that. Okay, so my last question for you, Dr. Kogan, is what is on the horizon for you? Any new books coming?
So I have, well, the soft edition is going to come out in, I think, late spring or early summer. It's a little bit updated, so there's not much that we put in. Part of it is the publisher doesn't want to see the fully rewritten book, which is we were going to add a lot, and they said no, wait, that's not how the publishing works. So but I also have the optimal aging book coming. And that actually started with Andrew Weil asked me to write that book some time ago. And that's that's a very different book. So the book is not necessarily anti-aging. The book is about what I do, which is integrative geriatrics. So I have lots of patients who are in their 70s and 80s, and they're complex. They have multiple medical problems. And how do you do this the best? So that's what the book is about. Right. Which I think is fabulous. I'm definitely going to be recommending that. So I want to know, but that's going to come out in the spring? It's going to come out. We're editor is still working. So I don't, it takes a little while. So I'm guessing it'll be more like a fall. Okay. Something to look forward to. So I will definitely want you back to talk about the book when it comes out. Absolutely. So like always, I think that you coming on is so helpful and gives so much more understanding to, I know a lot of my clients and listeners that are just really trying to understand more of how this works, whether it's, sleeping, spasticity. I've got one that has psoriasis really bad and wanting to get on something that that would help with that. We published the case of basically a complete resolution of psoriasis using topical THC. Really? And I actually now get like a steady, after that case, I have patients every couple of months who get referred to me for that. And interesting. Success rate is huge. Wow. So just using a topical? At least 50% success. Wow. So if it's on their body, they just use like a topical. If they have a severe situation where it's all over, it's a little harder. But the case we basically documented, you can just Google my name in case psoriasis. It's open access. Okay. Is it open? Well, you can find it, at least the abstract. Yeah. And so, it's a very profound anti-inflammatory tool topically. And I'm a little surprised that we're not seeing more topical applications. Yeah. I think it has to do with the market more than anything else. Because I used it a lot for the muscles, like in my neck and shoulders and forearms. It's amazing because also if you don't have to swallow it, it doesn't go through the digestive tract, it doesn't go through the liver, you're never going to get hyperactivation. So you've got chances of getting high are much lower. Right. Chances of any side effects, dry mouth, frequent urination, all those things, dizziness, all the things that we typically associate with the common use. Right. They're much, much less. In fact, they're usually non-existent. Yeah. Yeah. No, I am surprised because I'll ask clients, well, have you used a rub? And no, and most of them have never used it. And I'll always talk about, so I'll look into that. So you have one that specifically. Yeah. And we have that case in the book. Okay. I'm going to look that. Because it actually was one of colleagues that put me on the cannabis. So I had like 2 or 3 people. Well, Donna Abrams was one, and then Beth Case was one, because I forgot how I met her, but she was one of those crusaders who was on 30 medications, got off of every single drug by using cannabis, and then became a coach. And so that's another thing. I will tell everybody, if you find a good person, they don't have to be a doctor. Right. They just have to have you in mind, and they have to understand the topic well enough. So Beth, in a way, understands this topic much better than I am. So I've learned all these things. So this was actually her patient. Okay. She just used, in essence, my academic expertise to write the case appropriately. Right. Very interesting. We published that case with the head of GW dermatology department. Wow. Okay. Because he's very interesting. But he's also interested in making money out of it now with some of the, because there's massive commercial interest in all this. Sure. So there are companies that are trying to get on the market to develop pharmaceutical products out of it. Yeah. Yeah. Oh, I understand. Yes. You ask what's next for me. Yeah. Put the books aside. So I'm seeing more and more benefit of cannabis as a disease modifying product for all neurodegenerative disorders. So I'm not talking about what we've covered today. I'm talking about curing Alzheimer's disease with cannabis. And it's not going to be the only treatment to cure Alzheimer's or Parkinson or MS, but it's going to be a part of the packet.
Yeah.
And with Alzheimer's, we have a program called RECODE, Dale Bredesen's work, that's already there.
Yeah.
I'm learning how to integrate cannabinoids into that, and we're seeing some things that we're starting to get this all orchestrated for publications and positioning it right. So I think that's the next step. I think the next step is when we're going to move away from just symptom management. We're going to start saying what disease modification, disease modifying effects can particular extracts have.
Right.
You know, and that will take a while because that requires a serious long-term research.
Sure. But I think honestly, Dr. Kogan, I think as many people that are nervous about it, you have a lot of patients right now that are really wanting off the medications. Right. So that for myself, I know that the disease modifying medications that I'm on, I'm getting to the point where I'm like, I want off it all.
And those are the patients who are going to drive the history here.
Yes.
But I feel some of the craziest things I've seen cannabis related, they were all from patients like this who said, I'm done with this. I'm not going to take the drugs. I'm going to try something else. And some of them succeed. And I'm not afraid of saying that, despite the fact that obviously I cannot substantiate this with some kind of randomized data.
Right.
But we will at some point, I have no doubt. The question is, what will that look like? That's the question. And I'm guessing it's not going to look like that the cannabis is going to solve everything. We're just going to see it as a part of the toolbox that's going to solve.
No, I love that. And I'm very excited to see that happen because I think more than ever, we've got more patient voices since COVID because we didn't have anything to do, right? We just were there and we all we became louder in what we wanted, what we needed. And most of patient voices were saying, no more medications, no more just turning me on to something different. And I think that that's becoming more vocal than ever before, that we want off. And so I think that's what you're going to see is more of us coming to cannabis than anything else, because we do not want to be put on, whatever the menu of medications that, that the doctors are being handed from the pharmaceutical companies, and that's the hot one right now. And so we're getting tired of that. So I'm excited, Dr. Kogan, for this.
My favorite expression, you go into a butcher, you're not going to buy a salad. So we have to learn where we're going to get our salads, and we have to learn what is our system to get our salad.
Right.
And that system is individual, and yes, it's unjust. And I have to say that, but at the same time, I think the grassroots of shifts will occur. I think eventually we're going to start seeing directions where financial infrastructures will begin lining up with finding the drivers, because after all, people going to go to providers who are going to make them better. And once there is a critical mass, which is already happening, we will start seeing practices that figure it out. They figure out how to do this on some kind of a mixed insurance cash based, where it's just going to become more obvious for insurance that they cannot just simply say, oh, you're doing non-standard, I'm going to drop you. They will not have that voice anymore. We're not there yet, but I think
not yet. No, thank you so much again, Dr. Kogan. I'm looking forward to when you come on with your book. I want to definitely have you on for that. And thank you for touching on the teens, the young adults, because I know for a lot of parents that that's becoming more nerve-wracking. And so when we've got some more answers for that, I'd love to have you on and just kind of go to what you see and seeing what we've got some handle on that at some point, which I definitely hope that we do. So thank you again for being on. And again, everybody, I hope you guys tune in. If you've not seen, I'll put the number of the podcast that Dr. Kogan did before, so you can listen to that one as well. So Dr. Kogan, hold on. And so thank you for listening. Don't forget to rate us with, of course, a 5, not a 3, not a 2, and come back in. We'll see you in a couple of weeks. and you'll see this podcast air in a few weeks. So talk to you guys later. We'll see you again soon. Thank you so much. Have a great day.